And it's West Text Wednesday. We have Dr. Beck here to talk about some of the latest health news. Thank you so much for being here.
Thank you for having me.
And this is important information, especially let's talk about what your options are if people are sick and they're at home. They can actually just go on the computer and see a doctor.
Yeah. We have something called virtual visits, and I want to differentiate that from a televisit or telemedicine or teledoc, where you can just talk to a doctor or medical provider on the phone. We have what's called virtual visits. So you get on your computer. It could be an iPad, a laptop, potentially even your phone, and you can access our website, and you can actually talk to a medical provider face-to-face via the internet.
Fantastic, especially with the flu conditions, and then we're also going to touch on COVID-19. So let's talk about the flu first and then kind of dive into that.
We're still seeing flu, and this year compared to years in the years past, as far as the flu is concerned, not a whole lot different. I mean, we're still seeing some straggling of influenza, and it's still out there, as are other cold and respiratory illnesses as well.
And so when we're looking at, I know a lot of authorities and officials, especially health officials, are trying to say, don't panic about the coronavirus. Testing, can we kind of dive into that? Is that something that if you feel symptoms, what's the protocol for that?
Well, first of all, there is not a readily available commercial test available for coronavirus or COVID-19, as opposed to the flu. If you come into the office with flu symptoms, you can put a swab in the nose, and within 10 or 15 minutes, we can have the results back and say, yes or no, you either have the flu or you don't, and we can differentiate A from B. It's treated the same. So there is diagnostic capabilities for flu, and there's treatment capabilities. Different for COVID-19. This is a new virus. We've never seen this virus before, say, 6 weeks ago, and it started in China. So you cannot expect to just come into the office or to an ER. Do not go to the ER if you just want to have a test for COVID-19. They're not going to do it. If you have the proper risk factors, in other words, if you've been exposed to someone that has documented COVID-19, or if you came from an area where it was endemic or very common, for instance, China, and you have the symptoms, high fever and cough and things like that, then it is appropriate to test you. Currently, the testing we have to send off to Lubbock. We have to obtain both nasal and throat swabs, and even, if possible, obtain sputum or mucus from that you're coughing up, and send that off to Lubbock. I'm not sure what the turnaround time is, but it's not like you can just come in and get tested. If you have mild symptoms, please don't come in and get tested. Now, we'd be glad to visit with you if you have concerns about COVID-19 on a virtual visit, but it's just not appropriate to come to the office or to the ER if you have symptoms of the flu. Again, we're going to rule out the flu first because it's much more prevalent.
So it's kind of best if you're having some severe symptoms. Let me rephrase that.
Okay.
If you're having those normal symptoms, to talk to a doctor, you can go through the virtual as well. Yeah. Only if you're having major complications is then you should be going to the ER.
Right. Now, if you have flu symptoms with a productive cough, high fever, difficulty breathing, then it is appropriate to seek medical care. And again, depending on how much difficulty you are having breathing, then it may be appropriate to go to the ER for those type of symptoms. But it's important to differentiate that if you go to a clinic or to the hospital, the COVID-19 test, it's not a readily available test.
Very good information there, things that we're all learning and unpacking here. And where can people contact you if they have questions?
Well, we have 3 locations in the Permian Basin. Our new office is on 1941 East 37th Street, and we have 2 locations in Midland. And you can also access our virtual visits via our website, which is www.westtexurgentcare.com.
Awesome. Dr. Beck, thank you so much for being here and bringing this vital, important information to us. And stay with us, everyone. After the break, we will take another look at our 10-day forecast, recap those top stories, and tell you what's happening around the basin. Stay tuned.